Estamos muy contentos de estar con ustedes en el día de hoy.
We are very happy to be with all of
Estamos
you
esperando unos
today,
segundos más para que sigan
and we will
ingresando
just
los
wait a few
participantes.
minutes while other participants continue to join.
Bien, son las 10 en punto hora del este, así
It
que
is
vamos
now
a dar inicio
officially
a
10
nuestro
a.m.
webinario
Eastern
sobre las
Time, so we
experiencias
will
y
officially
lecciones
begin our
aprendidas en el
webinar on
desarrollo de
experiences and
hojas de
lessons
ruta
learned in
para
developing
acelerar y
disease
mantener la
elimination
eliminación de las enfermedades
roadmaps
transmisibles en la región de las Américas.
in the
Es un
region of
gusto
the
tenerles el
Americas.
día de hoy.
It's a pleasure
Vamos
to
a contar
be with all
entonces
of you today.
experiencias de los
This
países
morning, we will
sobre el
hear
desarrollo de sus
several
hojas de ruta y
experiences
entender un
from
poco
all
mejor
several
cómo será el
countries
proceso.
to
Así
understand the
que estamos
roadmaps and the
seguros que va a
processes that
ser
they
una
have been
sesión
going through.
muy
We are
productiva e
sure that it will be
informativa.
a very productive,
Para
enlightening
todos
session
los
for
acompañantes y
everyone.
todas las que nos acompañan,
And
tenemos
for
servicios de interpretación
all of us, I
simultánea
think it's
en
a good
inglés,
reminder
español,
that we have
francés y
interpretation,
portugués.
simultaneous
Tenemos
interpretation in English,
habilitada la
Spanish, French,
opción de
and
preguntas y
Portuguese this
respuestas en
morning.
la cual
We
les
also
invitamos
have
a que
the
hagan sus
Q&A
preguntas a lo
feature
largo de este
active on
webinario
Zoom, so
y
please feel free
después
to
del
share
panel
any
que
questions
tendremos
that
sobre
you have
experiencias de
throughout the
países,
session.
abriremos
And
un
after the
espacio para
panel
responder algunas de
of
las
country
preguntas que hayan
experiences, we will
aparecido.
also have
Mi
some
nombre es
time
Marta
to
Saboya, yo
answer
soy
those
la asesora
questions. I
principal
am
de
Marta
la
Saboya.
Iniciativa para la
I
Eliminación de
am
más de
the
30 enfermedades en
main
la región de
senior
las
advisor
Américas
for the
y trabajo con la
Elimination
Organización
Initiative.
Panamericana
I
de
work
la
for
Salud.
the Pan American Health Organization.
En esta mañana nos
And
acompaña el
this
doctor
morning,
Silván Aldigueri,
we have with us
director
Dr.
del
Silvan
Departamento
Aldegueri,
de
who
Prevención,
is the
Control y
director
Eliminación de
of
Enfermedades
the
Transmisibles
Department for
en
the
la Organización
Prevention,
Panamericana de
Control,
la
and
Salud.
Elimination of
A continuación,
Communicable
con la más grata
Diseases in
bienvenida,
the Pan American
vaya a
Health
darnos sus palabras de
Organization.
apertura, doctor
Please
Aldigueri,
welcome
en esta
Dr.
sesión.
Aldegueri,
Bienvenido de
and
nuevo.
let's hear your opening remarks,
Bien,
please.
en español. Muchas gracias, doctor Marta
I will
Saboya.
speak in
Es
Spanish.
un
Thank you very
gusto
much,
de estar
Dr.
con
Marta
todos
Saboya.
ustedes.
It's a pleasure to be here with all of
Son
you.
realmente puntos centrales de nuestro trabajo en el marco de la
And
iniciativa
it's really
de
important to consider the work
epidemias.
that we're doing
Son
in the framework
recordarles
of
a todas, todos
our
el objetivo
project for the elimination
de
of
la
communicable
iniciativa de
diseases.
eliminación, que es
The
una
goal
resolución del Consejo
of
Directivo de la
this
OPS,
initiative, which was a
de
decision, a
eliminar
resolution made by the
más de
governing
30
body of
enfermedades y
PAHO, is
condiciones
to eliminate
para el
over
año
30 diseases,
2030.
conditions, by the year
Por
2030.
supuesto, es un objetivo muy
This
ambicioso
is, of
y por
course, a
supuesto
very
sabemos
ambitious
que vamos
goal,
a tener velocidad de diferente
and we know that the
de
rate
implementación.
at which
Son
the
las
implementation is achieved
hojas de
will vary
ruta
from country
a
to
nivel de
country.
país.
But
Son
there
un
are
pilar
roadmaps
fundamental
at a
de este
country
proceso de
level, which
eliminación
are
país por
the
país.
basis
Y
of
porque se
this
necesita
process
lograr un
towards
compromiso
elimination.
político
It is
y técnico
important to have both a
y estar
political
con la
commitment
veracidad
and a technical
para los
commitment
aspectos de manejo científico.
in order to manage
So,
all the scientific data.
quisiera destacar 4 puntos en eso.
There are
La
four main points that I would
priorización
like
de
to
enfermedades y
highlight.
condiciones, que
First,
por supuesto
prioritizing
las
diseases
30
and
enfermedades y
conditions,
condiciones
because
no
of
se reflejan
course,
en cada
all
país
30
del
diseases are
territorio
not necessarily
de esa
present
región.
in
Cada
all
región sabemos que
countries
tenemos
in the
ambientes
region
sumamente
in the
diferentes,
same extent. The
ecosistemas
context, the
humanos
environments are very
como
different. The
naturales
human
totalmente
and natural
diferentes
ecosystems
entre
are very
América Central,
different.
Mesoamérica,
We have
el
Central
Caribe
America,
y
Mesoamerica,
América
we
del Sur.
have the Caribbean and South America,
Otro
which
de
are
los
very
puntos
distinct
importantes
regions. And
es
another
de
important point
identificar
is
intervenciones
identifying
aceleradoras para esas actividades
interventions that
de eliminación.
facilitate or accelerate elimination
Después, el tercer
activities.
punto clave es de
Then the
superar
third
los cuellos de
key
botellas
aspect is
en el
overcoming
desarrollo como la
bottlenecks
implementación
in the
de los
development
planes,
and
de las hojas de ruta.
implementation of the
Y
plans of the
finalmente, definir
roadmaps.
hitos y acciones
And finally, defining
comunes entre las 4 líneas
roadmaps
de
and
la,
common goals
del marco de
in the
la
four
iniciativa de
strategic
eliminación.
lines of the framework
En el
in
marco
the
del uno,
strategy
una
for the
atención
elimination
primaria en
of
salud
diseases.
fortalecida.
First, primary
Segundo,
health care
seguridad,
should be
una
stronger.
vigilancia
Second,
integrada, incluyendo
an
aspectos
integrated
laboratorios.
monitoring,
Tercero,
including
tomar en cuenta los determinantes
laboratory
sociales y
testing.
ambientales de la
Thirdly,
salud. Y finalmente,
understanding
asegurar
social
que no
and
se aplica
environmental
otra
health
eliminación,
determinants. And
stewardship,
finally, coordinating
de esas actividades.
funding and stewardship
So,
of all those
realmente este
activities.
evento
This
de hoy
webinar, the
es
event we
parte
are
de
having
nuestra
today, is part
experiencia
of
a nivel regional
our regional experience
de cómo se hizo el trabajo durante los últimos
to
3
share
años. ¿Por
how
qué digo
this
3
work has
años?
been carried out
Porque
in
en
the last 3 years,
2023 la iniciativa fue
because this
reposicionada
initiative
por
was
nuestro director a
repositioned
partir
by
del
our
Consejo
director
Directivo
in
y en un periodo
2023
post-pandémico donde la
after
gran
the
mayoría
COVID
de los
pandemic,
programas de
where
control
most of
y
the
eliminación
control programs
habían
and
padecido
elimination
golpes muy
programs
fuertes a nivel
had
de recursos
suffered
humanos y de
significant setbacks
financiamiento.
in terms
El
of
golpe
funding, human
del
resources.
SARS-CoV-2 ha sido
The
tremendo en la mayoría
SARS-CoV-2 virus was a
de los casos.
tremendous setback
Agradezco
for most of the
de manera
programs.
muy especial
So I would
la
really like
participación de
to
los equipos
acknowledge and
nacionales que nos van a
thank
prestar
all of the country teams for their participation in today's
y
webinar.
los
They are here to
panelistas.
share their
Por ejemplo, en
experiences,
Colombia, la
and
doctora Adriana
especially our
Castillo,
panelists.
en
For instance, from
Guyana,
Colombia, Dr. Adriana Castillo,
Rita Niles,
from
y
Guyana,
en
Rita
Honduras,
Niles,
Odalis
and
García.
Honduras,
Y por supuesto,
Odalis
quisiera
Garcia.
agradecer las oficinas país,
And I
nuestros
do want to thank
representantes
all of the country
en los
offices
países
and
y nuestros
their
puntos focales para la
representatives,
iniciativa de eliminación.
our focal
So,
points in the
realmente
elimination
quisiera
initiative.
compartir con ustedes el objetivo de este webinario
The goal
es
of today's
poder
webinar
compartir experiencias
is to share
en un
experiences
contexto de respeto mutuo. Tenemos todos que
in
aprender
mutual
algo del
respect and
país vecino,
recognition. We
porque
all have
estamos al
something
otro
to
lado del
learn from
Océano.
our neighboring
So,
countries and
muchas
from
gracias
countries
por
that
su
might even be
participación
very
y
far
otra
away
vez
from us within our continent. So
para la
thank you very
audiencia es
much
muy
for your
importante tener este
participation.
acceso
For
directo a
PAHO,
los
it is extremely
investigadores.
important to have
Muchísimas gracias.
direct
En
access
este
to the
momento
research
quisiera
and
de
results
nuevo
coming
dar
from the
la
specific
palabra
countries.
a la
And
doctora Marta
thank you very much for your
Gracias.
attention. Now I would like to
Muchas
hand it over to
gracias,
Dr. Marta
Silvan,
Saboya.
por la
Thank you,
apertura de este importante
Silvan,
webinar que,
for
como tú
opening this very
bien
important
mencionaste,
webinar.
tiene la intención y
As
el
you well
objetivo de
said, the
compartir
goal
la
of
experiencia de
this
la región de
webinar
las
is
Américas y lo que
exchanging
estamos haciendo
experiences, sharing
hojas de
knowledge
ruta para
that is coming from
eliminación
the regions of the
multidisciplinares.
Americas in
Es
terms of
una
what we are doing
iniciativa
in
compleja y
our
por eso nos
roadmaps to
interesaba hoy
accelerate
contar
the
con la
elimination
presencia
of
de los
diseases.
colegas
It's
de
a
seis
very
países
important
que puedan
initiative, and
hablarnos de
that's
su
why
experiencia
we
nacional, cómo se
are
está haciendo la aceleración.
really grateful
Y
to
un
have
poco para entrar
3
en
colleagues from 3
interactividad con
different
quienes
countries
están
that will be sharing their
participando hoy de
national
este webinario,
experiences.
vamos a hacerles
So
un
to
par de
start
preguntas
interacting with our
entender un poco
guests
mejor el
today,
panorama de la
I will
eliminación
ask
multienfermedad. Así que le voy a pedir a
some
Jackie
questions.
que las lance. Ahí tienen ustedes. Si ustedes
I have
mueven
just asked
hacia
Jackie
arriba y
to
hacia
open
abajo
up
la
this
barra derecha,
poll.
ya
You
saben,
should be
allí en
able
aquel
to see
espacio
it. There's a
van a tener dos
window
preguntas. La
available
primera
where you will
es,
find 2
¿cuál de las
questions to
siguientes
start our
enfermedades o
interaction.
condiciones
The first is,
relacionadas
which of
están
the following
incluidas en la
diseases or related
iniciativa de
conditions are
eliminación?
included
Entonces
in the
pueden
initiative
seleccionar,
for
tienen
the elimination of
pueden seleccionar
diseases?
múltiples
You can
enfermedades.
choose
Espero
more
que
than
así
one
está.
option. I
Muy
hope
bien.
this is clear to
Y
everyone. And
la
then
segunda pregunta
the
está un poquito
second
más abajo.
question you will
¿Cuáles de las
find
siguientes
below.
estrategias o
Which of the following
intervenciones
strategies or
son
interventions
necesarias
are
para lograr
necessary to
y
achieve
mantener
and
la eliminación
maintain
de
the
las
elimination
enfermedades
of diseases
incluidas en esta
included in
iniciativa
the
de eliminación?
elimination initiative?
Vamos a darles allí unos segunditos para que
I will
contesten.
give you a few seconds to answer these questions.
Bueno, de las enfermedades que pusimos en la primera
And of the
pregunta,
diseases
la
that
gran
were
mayoría
included in the
seleccionaron que
first
todas
question,
ellas hacen parte
most
de la
have
iniciativa de eliminación,
selected all of them
incluyendo
as
la
being conditions
defecación al aire
or
libre, que aunque no
diseases
es una
included in
enfermedad,
the elimination,
es un
including
factor de riesgo
open air
ambiental que para la
defecation,
región
which
de las
is
Américas
an
está por
environmental
meta de
risk in the
eliminación.
region of the
También
Americas, and
tenemos
that is
la
why the goal
eliminación
is
del
to
uso de los
eliminate
fuels
it, as well
contaminantes en
as
el
the
hogar
use of
dentro de la iniciativa.
polluting
Así que
fuels
efectivamente
in
todas
households.
las
That's
enfermedades
also
que están
part of the
listadas
initiative.
allí
And yes, it is
hacen
true.
parte de
All
la
of those
iniciativa de
conditions
eliminación de
listed there
enfermedades en la región de
are
las Américas.
part of the
Y con
elimination
respecto a
initiative
las
for the
estrategias e
Americas.
intervenciones
Regarding the
necesarias
strategies and
para lograr y
interventions that are
mantener la
necessary to
eliminación
achieve
de
or
estas
maintain the
enfermedades,
elimination of these diseases,
efectivamente, todas las que están allí
again,
hacen
all
parte,
of the
porque la
options are
eliminación de
part of the
enfermedades
initiative.
es un ejercicio de
The
implementación de acciones
elimination of diseases
integradas, tanto en
requires an
prevención,
integrated approach
tamizaje,
for prevention,
diagnóstico,
screening,
tratamiento,
diagnostic,
rehabilitación,
treatment,
investigación, todas
rehabilitation,
las
research,
intervenciones que tienen que ver con
every
determinantes
intervention
sociales y
related with
ambientales,
social and environmental
atención primaria en
determinants,
salud,
primary
fortalecimiento
health care, funding, a better governance, all of those are strategic actions within the Elimination Initiative. So this already helps us to break the ice. We have started talking about the elimination already. And now I will share a little bit about the tools and methodologies that are being implemented in the Americas in order to understand when we talk about roadmaps, what we are talking about. I will share in the next few minutes what is the process that we're currently carrying out to support all of the countries in the regions and what are the specific steps that we are taking. So first of all, I would like to echo the words of Dr. Silvani. The initiative for the elimination of diseases was approved by all member states of PAHO in 2019, when this document that you see here in the left side of your screen was introduced, which is the mandate to eliminate several diseases. Then, second of all, we have the resolution that was approved by the ministers of health across the Americas, aiming to eliminate over 30 diseases and related conditions by 2030. And what the initiative proposes is to promote our efforts by implementing 4 strategies that are common for all diseases. First, fostering the processes and collaboration to achieve elimination targets. Second of all, strengthening information systems and monitoring systems in order to understand where we stand and to be able to make evidence-based decisions, tackling environmental and social determinants, not only to promote elimination, but also to guarantee the management, and finally, to strengthen governance and funding, understanding that countries and governments need to introduce them in their structures in order to guarantee sustainability. And this entails also implementing actions throughout the life cycle, everything related to equity, rights, and being able to reach vulnerable populations. So this is the core of the Elimination Initiative. That's what makes it so complex. It is not only about analyzing the specific diseases, but going beyond that through all of these cross-cutting areas. So what are we currently doing in the technical cooperation to support countries in drafting their roadmaps? And it's important to call countries to draft their roadmaps because it's where the action lies. It's not simply a plan, it's where specific efforts can be introduced to eliminate diseases. So what are the methodologies that we're introducing with countries? First of all, we have to understand that developing roadmaps is a process. It's not just a workshop, it's not just a document, it's not just someone sitting down and writing it down. Roadmaps are a process where we carry out discussions with countries to try to identify what we seek to eliminate, where we need to accelerate, what implementations need to be made, and what we need to monitor. The process in the last 3 years has been structured in steps. The first step is a high-level commitment by establishing a high-level coordination that will be in charge of the process, remembering that it's a multifaceted process, it involves many stakeholders. Once that coordination is established, it's necessary to determine what diseases will be included in the agenda for elimination in that country, and then doing an analysis of the critical bottlenecks that are preventing us from moving forward or moving faster towards elimination. What solutions could potentially support, and what would be the new watersheds for elimination that countries can propose? And that led us to the third step. We have to identify the cross-cutting actions that can be common for several diseases, and those are the accelerating actions. This is a term that you will see again and again throughout this seminar. And once we have that, then the roadmap can be drafted, implementation can begin, and finally, monitoring. Let me take a moment to talk a little bit more about details of these steps. First of all, what is the coordinating group? It's a process that takes time. Leadership must begin at a sector level, so in the healthcare sector, from the highest level possible. And by that, we mean the Minister of Health and the Vice Ministers of Health. If the dialogue doesn't begin with the highest authorities, then we are failing to position the issue at the highest level of the country's agenda. If the goal is to eliminate diseases, then that sector leadership needs to be established. Afterwards, the minister has to identify who will be the strategic technical stakeholders that will be leading the process. And that means identifying a group of individuals, experts in elimination programs, experts in the cross-cutting topics, in funding, in service provision, who can collaborate together, being coordinated by someone who will have a mandate, a task that is delegated from the highest level. And so there has to be a permanent communication in decision making. It shows the political commitment and the strategic commitment of countries with this program. Afterwards, more stakeholders and national agencies, sectors will have to be involved, of course, because we're talking about actions that will accelerate and maintain elimination of diseases. And this cannot be achieved simply through the effort of a single sector. So that leads then to group work sessions that involve several individuals with the highest levels of expertise. And we have found that these technical groups, even within the minister, are not always knowledgeable about all of the potential bottlenecks and solutions, and that means that we end up missing part of the information. This happens in every single institution. We tend to work in silos. Sometimes we're disconnected and we fail to sit down to exchange knowledge and evidence that will be useful for us to actually work towards elimination of diseases. So that led us to the second step, which was analyzing what diseases would be included in the roadmap. And here I have an important message to share. It's always important to identify priority diseases for decision makers. When we talk about priority diseases, that means that other diseases are left out, right? But we want to shift that perspective. We are trying to identify the endemic conditions and diseases in a country that can be eliminated and therefore should be included in the agenda. Because if we put decision makers in a position where they have to decide what's more important, HIV or leprosy, malaria or salmonellitis, this is a very complex decision. So instead of that, we have to say, okay, these are the diseases that must be eliminated in the country. This is the agenda. This positions the topic in an entirely different level. We can do a critical analysis with the countries to see which diseases can be eliminated, where the country stands in terms of that goal of elimination. And once that is clear, then what can be accelerated by identifying those critical bottlenecks and potential solutions to achieve that elimination. So again, a roadmap, an elimination plan is not a document that says chapter 1, tuberculosis, chapter 2, malaria, chapter 3, HIV. No, it's a map that tells us what is not working and what problems do we identify that once they are solved can help to accelerate elimination. That's the idea, identifying those critical bottlenecks to be able to get rid of them and move forward. If those bottlenecks are solved, broken through, then there will be a new timeline and new potential moments where we know decisions can be made critically. And that can lead us to implementing some tools that we have identified in PAHO. The first is establishing for every disease what are the indicators of elimination. So how can they be measured? What are the metrics? What are the program indicators that we will have to see in order to achieve elimination? And where does the country stand in each one? Then what actions can be implemented in order to achieve those eliminations? And for that, we have also created the regional database. It's a portal where you will see what countries are using as sources for their roadmaps. Here is a list of diseases that have been included in dark green, and this is an example of a country that shall not be named, but in green we have diseases that have been eliminated already. For instance, smallpox, we recently lost the certification for measles, but we hope to be able to recover that. And then there are others in orange where we see that countries are close to achieving elimination. That means that there's an incentive there for the authorities to say, okay, so we see this country in orange. There are 20 diseases where maybe it is not very close to elimination, but if actions are taken, then eventually that can be reached. So again, it's not about establishing a priority list, but an agenda that includes all of these diseases and then identifying a roadmap with the country where every stakeholder involved can participate, not only program leads or laboratory directors, people in charge of planning, of information systems, regulatory experts, funding experts, program structure experts. Everyone has to be involved in the discussion. And once the agenda is set, then identifying why aren't we moving forward? What are we missing? It's not the head of a program saying, I'm missing this. It's a whole team full of people from many sectors saying, okay, these are the actions that need to be promoted. In that database, we see in all of the diseases, this is an example of tuberculosis, what is the target that we hope to achieve, and each country in their roadmap has to ask themselves, okay, why do we have this rate of tuberculosis? How far are we from the goal? The goal is in green. If we are close, then how close are we? Are we really that close? What do the indicators look like, and how can we guarantee that we will move there faster?
This is the example of hepatitis B. We have here the indicators, the goals, and according to the recent data, how far and we close are from that goal. And we need to ask ourselves why. What are the bottlenecks? Either to protect the numbers or to accelerate the actions that we need to do in order to be able to reach the goals. Now, we have developed a tool called the Best Buys. These are documents that are pretty easy where you can see the most cost-effective interventions that would allow them to accelerate the elimination of these diseases, and in a very simple way, in one page per disease, we have given the goal, the impact goal, the elimination target, the programmatic targets, and what is the action steps to achieve elimination. So where do you need to invest in order to be able to accelerate the elimination? They are available in 4 languages, and we invite you to use them. And based on the analysis and the bottlenecks and solutions, that's where a country may decide how can they commit to the elimination of milestones. How can they do it either partially or total elimination of some of the diseases that we have here? We have either a combination of diseases like TB or malaria, leprosy, and this changes the whole perspective of the country, because we need to see that we can move towards an elimination agenda more comprehensive as a group or as a country to accelerate. the elimination. And it is very important that we do that, that all the accelerating actions can be measured from the cross-cutting elements, because we can see this by disease, but when we analyze them in detail, we have a lot of critical points that they are touched upon in each disease, and the solutions, sometimes many of them, if we've managed to implement them, they will solve the most critical parts of the diseases. So they become, this turns to how can we accelerate the actions, and by means of each initiative, how do we establish the objectives and the expected results, the timing, and who are those that are going to be responsible for the implementation of these accelerators, and how can we formulate and launch our roadmap? And this takes me to the second dashboard. I show you already the charts, and these are, for example, by disease, mortality, number of cases, and the second dashboard that we have allow you to see by country, by each one of the lines and the initiatives, some indicators to see whether if we can find them, and certain things that are necessary to accelerate the elimination of diseases. And we have given here some information that is very valuable. And in this transversal actions, we will have some main things, like how are we going to respond through the capacity that we have in order to overcome the new consensus, and that we know that without this we will not be able to move forward or towards an elimination. So this takes us to, well, not the final part, but because there's never a final part, but to structure the roadmap or the action plan document each country, and depending on the regulations, and you can name it as you want, to adopt this formally. I have an official adoption document so that it becomes a regulatory mandate to discuss and agree on the structuring of the monitoring framework for action, and also to initiate implementation considering the subnational context. And this is an example of a plan launched by Panama, their national multi-disease elimination of multi-diseases with 25 events, and they have all this adopted by a presidential decree that involves more than 25 people between national institutions and officials in order to accelerate the elimination of diseases. So something that you can see very easy, it's a result of a very long process between different agencies and organizations in order to be able to accelerate elimination. What is all this good for? Well, the first thing is that it helps us to have a more extended involvement of the authorities that sometimes are not involved in the elimination of diseases. This is, they have one common objective. They don't have, for example, separate agendas from the different parties. They have one elimination agenda, and it becomes a more deep involvement from all the stakeholders. So this takes us to have a change in focus. For example, what are the critical bottlenecks? I don't want you to tell me what you do well. I want you to tell me where are the bottlenecks that you need to solve in order to move forward. And this takes us to a strategic transition, not only to talk about how prioritize diseases, because they're all important, but to say, this is the agenda, this is what we need to work with in order to move forward with elimination. And during this past 3 years, we have learned with the countries of the region tools that we know that they're important in order to develop this, like monitoring indicators, the best investments or the best buys. And once that we go to each country, we come back, we adjust the agendas, and that's how we learn how other countries deal with this. And we, of course, invite you to go to our webpage of the Elimination Initiative, and you will be able to find all the elements that I'm talking to you about, including the best buys in the portal of data. Now, in theory, this seems to be so easy, so nice, but sometimes it's not that easy. And this is why today we have 3 excellent panelists who are going to talk to us about how does this look like in practice. So it is a great honor for me to have three excellent leaders on their country. Adriana Castillo, she is a professional of epidemic diseases of the promotion and prevention of the health ministry in Colombia. Adriana, welcome. We also have the participation of Odalis Garcia. She is the chief of non-communicable diseases and infectious diseases in Honduras. I imagine that you have a whole list of diseases. And also it is a great honor for me to have the participation of Dr. Reza Niles Robin. She is the head of the control vector diseases in Guyana. Dr. Niles, you're more than welcome to the panel. So for us, this is more like a conversation because we are very interested in learning and that our participants hear from your experience. So you three have been deeply involved and leading all the elimination process in your countries, and you have even developed all these roadmaps in your own countries. So I'm going to be interacting with each one of you, and then we will have a joint session so that we can discuss some of the common elements that we are seeing. For example, Dr. Niles, I'm going to talk to you in English so that for my interpreters, I'm going to change languages whenever I start talking to her. So I'm going to start with Adriana. Adriana, you're very welcome to the panel. Thank you so much for your time and for sharing with us the experience. So the first question, Colombia, I know that you have started a whole process of formulating your roadmap, and I would like to hear from you. How is it that Colombia is aligning this formulation of the roadmap with your national health priorities and with existing elimination or control strategies? So, Adriana, please. Good morning, everyone. I'm just confirming that everyone can hear me well. Thank you so much. So, Dr. Marta Saboya and all the team from PAHO, Washington, thank you. Thank you to all my fellow colleagues here. First of all, I want to say hi on behalf of the Minister, Health Minister, Mr. Jaramillo, and Vice Minister of Social Protection, Jaime Orrego. So, answering your question, let me say that Colombia has built a roadmap for the elimination of communicable diseases and those that they've been considered in our country, and this is a priority for us. Now, the fact that we align this formulation corresponds to three levels: political, programmatic, and territorial. We build the roadmap according to the health program that we have in our country, that is from 2022 to 2031. The rural health, considering also that this is a huge bet, the fact that we can take all these initiatives to rural populations, and also the preventive health model based on primary attention. Now, we can guarantee that we have this document aligned with the strategic movements that are basically equity, focus, life, intersectoriality, and also other diseases. We have managed to include the National Plan of Elimination in our country, and with new policies and decrees from the health minister, in order not to leave this in what is promotion and prevention from our side, but also to be able to have a greater impact and to involve in other policies like environmental, the basic health care, and also to work with the resolution that we're going to have based on the communitary sites. Now, also the elimination plan that we have adopted in the country included the same four operative lines that we have in the regional elimination policy. And based on this, that's how we were able to set the key activities that we were going to work on, then that this could take us to a greater impact to be able to achieve the goals of a final elimination of diseases. So everything that has to do with strengthening of health, services, the integral networks that are part of the health system based on the territories, of course, also the integral roadmaps of health care, the basic teams, like for example, these are the main stakeholders in order to be able to bring diagnosis and follow up into the rural areas, as I told you a minute ago, in order to align all the information systems, surveillance, and we are committed to be able to guarantee the interoperability in order to be able to have a study case, study cases, and also to be able to prevent diseases and strengthening everything that has to do with reactive surveillance, and also that we have to be very reactive in case that we detect a case that can put in risk all the goals, and also the communitary surveillance. This can take us to be able to have a more on-time response, and also the social and environmental aspects. We have bet on uh, being able to be able to work with the territories, like for example, the intersectorial public health, the CONASA, COTSA, where the intersectorial commission, and after all the dialogues that we have discussed on the tables with the different ministries of the country, we've managed to include 12 strategic actions that not only they provide a better impact on the health determinants, and also to eliminate the 22 diseases that we are proposing to eliminate in this initiative, but also other diseases that we have seen in the country. And finally, for governance and finance, we propose to have a sustainability and assurance of the different resources that we will use, as well as to involve all the health systems, including the community, considering that they are the only ones that will help us to start from creating awareness, that the fact that they recognize how important it is to eliminate all these diseases for their communities, and then they will accept the strategies that we are proposing. Thirdly, and after going through all these steps that I've just explained, we have to, I mean, the roadmap, we use all the, in the roadmap, we use all the current guidelines, and we want to use or to benefit from all the programs that are still valid in our country and that they've been successful. For example, there's a pre-immunization program, and we have others, and we are have some other diseases that we want to try, for example, vector integral management, and also TB, leprosy, and other diseases programs that we have. And in order to be able to avoid any duplication of resources and efforts and the results that we have between the different programs. So, and the fact that we work with the territories, this has been paramount, because the fact that we want to include these goals in the territories, and the fact that we can analyze the situation and their planning, this would allow us to be able to address the situations in the most vulnerable communities, for example, the most vulnerable communities. So this is how we adopt a route that is not only technical, but also thinking about the interoperability. And this becomes an important instrument of social transformation, where we align all the goals, also all the sustainable development goals, the regional sustainability goals, and also everything related to health, so that we can be a country free of diseases or conditions that will prevail the inequities in different territories. Adriana, that was great. Thank you so much, because in the case of Colombia, it is amazing how you've been able to find a way of leveraging, I love the word leverage, from what you already have, and what can that be used in order to accelerate other initiatives, because you said that you have 12 strategic alliances in order to be able to eliminate 12 or more diseases. We are not talking that one disease is more important than others. You understand that you you have differences, and this is why the territorial part, we need to accelerate that. So from your perspective and the strategic and standard perspective, Adriana, you gave us a great overview. And this is going to allow us to generate another question to Dr. Dalis Garcia from the Health Ministry of Honduras. Odalis, thank you so much. Thank you for your participation and for your willingness to share with us your experience. I know that this is not enough time to say everything that we wanted to say, because this is a very long process, but I just want to ask you, Odalis, what are the main opportunities and challenges identified so far in the process of formulating the roadmap in the multi-disease elimination in Honduras? I know that you are in the last phase before launching. So can you please tell us a little bit about those main opportunities and challenges? I know that this is going to be very important for all of us. Good morning, everyone. Thank you, Doctora Saboya, and also the colleagues of the regional office and the PAHO office, and also the office country in Honduras.
Thank you very much for inviting me to this very important webinar. And first of all, I would like to extend my greetings on behalf of our Health Ministry, Dr. Carla Marina Paredes, and our Vice Minister, Dr. Brian Erazo. He has been given the mandate by the minister, and he has been very much involved in the process to be able to get to where we are right now in our country, as Marta well said. So, elaborating our roadmap for the elimination of diseases in Honduras has been a very collaborative effort with the Health Ministry, the Pan American Health Organization. We have collaborated in order to identify the factors that could help accelerate also the critical bottlenecks that have to be overcome in order to achieve implementation and finally reach the goals. We have had many opportunities that have been identified, as well as challenges throughout our analysis. And one of the opportunities that we have identified is that Honduras has been very successful in terms of political will and commitment. So there is a technical credibility, because in the past we have already eliminated several diseases that have been mentioned by other speakers. For instance, measles, polio, and this, together with the technical support that our authorities are giving and the technical cooperation with PAHO, creates a very positive political environment in terms of funding and implementation of the roadmap. We also believe that strategic partnerships has opened the door to working beyond the healthcare sector, having the municipal authorities involved with the Association of Municipal Authorities of Honduras. There is also a strong participation of the National Autonomous University of Honduras, the environmental sector, also international cooperation. I already mentioned PAHO, but also other donors that have supported us in finding this shared vision and coordinated effort to reach the goals. Honduras, from the beginning, started working with the 4 pillars that were mentioned by Dr. Saboya. There was an analysis that was carried out disease per disease, and this was carried out with an interdisciplinary approach, always identifying the potential challenges and potential solutions as well, ways to overcome all of these difficulties. We believe that one of our strengths has been capacity building at a national level. The ministries of health at a local level have been trained in order to guarantee an effective and sustainable implementation of our roadmap. Also strengthening primary health care. That's what we're doing right now in Honduras. primary health care is being strengthened by incorporating actions for the elimination in services at the very first level of attention to give greater coverage, continuity, and sustainability to the actions that are being implemented to reach the goals of elimination. Something else that the country is really encouraging is digital transformation. We believe that this is a very favorable moment. The country's roadmap also included a digital transformation from 2024 to 2030 in order to modernize our information systems, to move from records on paper to digital records. Having real-time monitoring is essential in order to be able to truly measure if diseases are being eliminated. Something else that we have identified is sources of funding and implementation mechanisms. We believe these are also two crucial steps towards the implementation of the roadmap. As a country, we have identified some challenges as well, some potential obstacles that we need to work on to achieve implementation and the sustainability of the actions that we have, especially not only to achieve elimination, but to sustain that elimination of many diseases. One of the challenges that we have identified is sustainability of funding. One of the greater risks that the country faces is being overly dependent on external funds and for specific programs. And the challenge is to guarantee our national budget so that the expenses of tests, vaccines, treatments can be progressively tackled and continuity can be achieved even at moments where international cooperation is not as strong as is the case today. Even though we are working and we have a plan to achieve that digital transformation that I mentioned, there's still a significant gap in our data systems. We have to work on the specific challenges that have been identified in terms of the quality and disaggregation of data to be able again to certify that a disease has truly been eliminated. And of course, having robust evidence that there is no transmission at a community level. This is very difficult in areas where the registers are simply not available or monitoring systems are not in place. Another challenge is accessibility in terms of remote areas where the most vulnerable populations live. This was mentioned by the panelists from Colombia. Some rural areas are very dispersed. There are indigenous communities, Afro-descendant communities. There are ideological and cultural obstacles that make universal screening, treatment, and follow-up difficult. And all of these are necessary steps in order to be able to state that a disease has been eliminated. There are also unresolved social determinants. The roadmap states that the healthcare sector cannot do this alone. So there are factors such as sanitation, access to clean water, deficiencies in terms of housing that can affect diseases and their elimination. We cannot deny that our infrastructure is often weak. We have difficulties in terms of internet access. This is being improved in the country, but there are still areas that face a significant gap and that need to be closed in order to have the right information that we need to document the elimination of diseases when they happen. Honduras, like other countries in the region, is currently preparing an election. We are preparing for an electoral process, and we don't know if there will be a government change. And of course, as we all know, when there are political changes, there tend to be changes as well in staff, even at the technical level, and that can decelerate our progress and the rate at which we can achieve our healthcare goals. But we are still optimistic that we will be able to include the roadmap in the new government's plans. Another challenge is technical expertise and human resources. There's always a lack of trained staff. There's very high turnover. And again, with the change of government, this is only highlighted. There's also a generational change. Sometimes knowledge transfer cannot be guaranteed in that generational change. This may affect continuous training or continuous knowledge. Attention at a local level can be poor, and therefore the implementation of some strategies also suffer some obstacles. We believe that the healthcare sector is very fragmented. We need a better communication between the public sector, so the health ministry, the social security institution, and the private sector. We face many difficulties when it comes to data and exchanging information with the private sector. Another challenge is that there's almost a complete lack of coordination between sectors. This leads to great inequalities, great inefficiency when it comes to expenses, and we find that attention is mostly aimed at treatment and healing of diseases instead of prevention. Although, as I said, I believe the country has been taking important steps towards strengthening primary health care. So we hope to be able to overcome all of these obstacles that have been identified in order to be ready to launch our final roadmap for the elimination of diseases with all of the multisectorial analysis, with the interdisciplinary approach, and to incorporate this roadmap, which is even more important, as I already said, in the new government's plans. This will be a very important step for our country. Once we have a new government, we have to make sure that the roadmap is adopted as a priority. Thank you. Thank you, Odalis. Thank you very much. I think you have made a very important comment in terms of identifying challenges, which are plentiful, and having an integrated roadmap will not solve those problems immediately. But that's the first step, identifying the difficulties. And something you said at the beginning of your intervention is that we have been capable of eliminating diseases. We have done this before. Some diseases have already been eliminated despite challenges. So this means that we can definitely move forward. We can do more. So of course, it's not there's reason to be optimistic. Once you identify diseases and you identify those obstacles, there's always a way forward. So thank you, Odalis, for sharing both the challenges. That's an important reality check, but also potential opportunities. So, of course, those challenges will have to be overcome in order to reach the solutions. Thank you, Dr. Odalis, for sharing the experience. And now I will switch to English.
It's my pleasure to welcome Dr. Risa Niles-Robin. She's the Director of the Vector Control Services in the Ministry of Health Guyana. So Dr. Risa Niles-Robin, thank you very much for your time to share with us your experience and lessons learned in Guyana in this endeavor of accelerating the elimination of multiple diseases. You have been working in the elimination of neglected tropical diseases for a long time in Guyana, especially for lymphatic filariasis. And now we know that the Ministry of Health, the Minister of Health of Guyana, has been a champion of how Guyana can eliminate not one nor two, but multiple diseases in the country. So based on that experience, Dr. Niles, I would like to ask you, what have been the key elements that have enabled the multi-disease elimination action in Guyana? to be translated into concrete actions at the local level? Because sometimes you can say, this is a plan for the national level, but how are you translating this into local action? And what progress do you consider most significant so far in Guyana?
Thank you, Dr. Saboya. Can you hear me clearly?
Very clear and loud.
Great. Thank you. I just want to thank you guys, especially PAHO, for inviting us to this important webinar. So far, it's been a validating experience listening to the other panelists. We share a lot of commonality. So far, I think we are validating the facts about elimination. I also want to say hi to the participants, and I hope that I'm able to share something that will help you guys accelerate towards elimination and encourage you, because you're not alone in the ups and the downs. So I try to pull out three main enablers, and then I'll highlight some tangible areas of progress. So as you have mentioned earlier, for me at number one, a clear political direction and national priority. So first, strong political leadership has been critical. I would say essential. Our Minister of Health, Dr. Frank Anthony, has clearly articulated our country's ambition to accelerate elimination or near elimination and even control of a few communicable diseases. And we say priority communicable diseases. It's roughly 12, and they include like malaria, lymphatic filariasis, leprosy, leishmaniasis, key vaccine preventable diseases, and other conditions under the EMTC+. Now, this clarity has aligned our national programs, our regional health services, our partners around a common direction. And this has shaped the type of technical support that we are willing to receive and that is offered to us. Especially PAHO has offered us targeted technical support, as well as other agencies such as CARFOR and even Harvard. Now, in practice, this political commitment gave the teams our mandate to move our thinking from just treating and control where relevant to pushing towards an elimination thinking. So wherever gains we have, taking them and moving forward. So that's the first point, clear political direction. Our second one, I would say, technical coordination and integrated models. So Guyana, we have invested in a technical coordination and integration rather than operating in silos where relevant. And the caveat is where relevant, because as you guys would know, the process is not always smooth. So we have a national technical working group that brings together vector-borne diseases, epidemiology and surveillance, HIV, TB, primary health care, the national labs, our regional health offices, as well as our technical partners, which is predominantly the Pan American Health Organization. Now, this group reviews data. We agree on priorities, we coordinate implementation, and I would say in summary, really the group helps us stay accountable, which is important so we don't lose sight of where we need to go. So although we don't yet have a fully articulated and launch roadmap, what we have is a technical working group that already plays a functional role. And hopefully one of the steps we'll move to is creating this roadmap, because we already see the need for it. Now, at the service delivery level, I'd say we see this coordination translated into integrated models. And a good example is in collaboration with the Pan American organization in one of our regions, Region 1, in a targeted area, Arakaca and our surrounding mine communities. What we've done is apply some integrated services. Malaria is endemic there, but we've also included HIV testing, commodities management, and supervision being delivered through a unified platform rather than a disconnected vertical activities. And so far, we've been able to see improved reach and efficiency in a very challenging hinterland environment. Matter of fact, we've seen almost a 50% drop in cases for malaria in that area. So we actually have the evidence of the work being done there already. And thirdly, but of course not the last, but just a main one, the progress has been enabled by stronger information and community systems. Now, on the information side, Guyana has been early adopter of integrated serosurveillance by embedding the multiplex beta-C into the filaria surveys, of course, in conjunction with our Pan-American Health Organization, CDC, and the other stakeholders. The country was able to generate a multi-pathogen exposure data that allowed us to plan, in some cases, specific diseases. It's micro-planning, micro-stratification, and even help us identify areas where risk still remains, even when the case numbers are low. So alongside that, there is an ongoing work to, of course, strengthen our labs and our digital architecture, yes, and of course, our surveillance, it should be timely and complete. But on the community side as well, or I should say, in addition, this initiative, such as we have some targeted initiatives such as the Region 9 Malaria Elimination Initiative to demonstrate how the elimination principles can be operationalized. So from theory into actual implementation. So in, for example, a small area, the South Rupununi, we were able to identify a regional malaria coordinator, elimination coordinator, that's important, a malaria ranger embedded in the community, and a full-time microscopist. The reason I'm being so explicit is that our aim was to have 24/7 testing, reactive case detection, community-led screening of the returning minors. And this was for us a concrete example of taking elimination agenda to the last mile, because in that specific regions, we have a very low number of malaria cases, and we found it to be a low-hanging fruit. We've seen a 54% reduction of cases since we've started that activity. So I would say, for example, bringing together all these elements, 4 areas that we've seen progress is in the relaunch and expansion of our filaria mass drug administration campaign. The evidence has been there from all the work that we've done, and we're doing a targeted intervention to hopefully carry us.
Dr. Niles, can you slow down a little bit? The interpreters need to
Oh my, I'm sorry.
It's okay.
I'll go slower here. So the 4 areas I would say of progress is with our filaria campaign, where we've been able to look at all the data, triangulation, as we call it, and we've been able to relaunch and have the expansion of our national filaria campaign, and hopefully that will propel us into the next years for bidding for validation, hopefully by 2027, 2028. We've also been able to have some early gains from these targeted interventions in these community-based models. Basically to say not all models fit across the board. So these targeted interventions have really helped us to see some gains early on. Operationalization of the integrated service delivery model like we saw in Region 1 does give us a platform to show what is compatible in the integration and what might not. Because of course, while we have these positive gains, we did have challenges coordinating the teams, moving away from this silo thinking and integrating where necessary, especially at the community level. And of course, the development of this integrated surveillance platform and even interpreting that data and analyzing that data. And of course, the technical working group that we have, those two together, I believe, has provided the analytical and the governance backbone for the communicable disease elimination and control. So I believe that these elements will help us when we work on our roadmap to have a concrete, I would say, in practice experience so that we can continue to work on eliminating diseases in Guyana.
Oh my gosh, Dr. Niles, you have
Thank
gave us a lot of information about what is happening in Guyana. And I know that when we were planning for this session, you said, I have to identify how I'm going to organize this because it's so much information about what is happening in Guyana that you try to deliver that message is that, and I can highlight that you mentioned governance, political commitment. So if we really want to accelerate the elimination of diseases, we cannot rely only on the program manager person or team. If we want to accelerate the elimination of multiple diseases, as you mentioned before, we need the highest possible commitment. So that way it's a mandate for all the teams. It's not only the job of one group within the Ministry of Health, it's the job of a technical working group engaging many people from different aspects. Of course, the technical teams working on the specific programs, malaria can be eliminated with malaria experts. That's absolutely clear. But if we see all the bottlenecks that the different programs are experienced in different areas of the country, you can identify, as you already said, what are the commonalities in terms of if we solve this bottleneck, maybe we can accelerate the elimination of these diseases. So you explain very well how you are using all these, plus using data, adapting interventions. So those elements are very important in the experience that you have shown us, Dr. Niles. Thank you very much for sharing that experience with us. So, and with that, I'm going to move into Colombia again. So now I'm going to switch into Spanish. Y Adriana, bueno, aquí ya empezamos a identificar
Okay,
cosas
now we can
comunes, ¿no?
start
Entonces, por ejemplo,
identifying
países como este,
common
Doctora
grounds
Luisa
between
Niles
the
en Guyana y
different three
también la
experiences
doctora
in
Odalis
Guyana
en
and
Honduras.
Honduras
En
with
el caso
Dr.
específico
Odalis.
de
Now, in the
Colombia,
cases
Diana,
of Colombia
ha
specifically,
sido un proceso bien complejo, el del Plan
it's been a
Nacional de
very
Eliminación de
complex
Enfermedades,
process.
y tú
I
has
know
estado
it,
desde el
and you've
principio
been
allí,
there since the beginning.
y es un proceso, es decir,
And
esto
I
no
know it
es
is a process.
no es una sentada, una
It is
sesión
not
y
just
todo
to
bien.
sit down on a
¿Qué
one
lecciones o
session and they're
recomendaciones tú
solved.
compartirías
So
con otros
what would
países que
be
están
the
pensando
recommendations that you like to share
iniciar
with
o
other
implementar
countries
este
that are
plan?
just
Pues algo
beginning
hasta
to
ahora.
formulate
¿Qué
their
les dirías
roadmaps?
tú basada en
What
tu
would you
experiencia
tell
hasta ahora?
them based on your experience?
Bueno, propondría más o
I would
menos
propose
5
at least
consejos
5
principales, sabiendo que son
main
muchos más de estos. Pero entonces, digamos que el primero
tips.
es como en la introducción de la charla, el
First
primero
of
es
all,
hacer un
the, be-
análisis
the first thing that
objetivo,
you need to do is to perform
minucioso
an
de
objective
la
and
situación
thorough
epidemiológica,
analysis of
por
the
supuesto, de las
epidemiological
enfermedades
situation and all the diseases that you are planning
la
to
iniciativa
eliminate,
tiene
because
más de
the
30
initiative has more than
enfermedades
30
y pues
diseases.
unas son
So
aplicables o no para
ones
los
may be
mismos países,
applicable
pero
to different
hay que ser
countries,
realistas
but
en
you
qué
need to
llegamos
be realistic
a alcanzar
and to
al plazo estipulado o qué podemos
decide, okay, which
acelerar para no saquear en
diseases we
preeliminación.
can
Por ejemplo, uno de los
work
más
with
ambiciosos es
or those that we
tuberculosis.
want to eliminate. In our
También hacer
case, for
como un
example, is
análisis
TB.
normativo y
Something
operativo
when we have
de las
the
enfermedades o
operative
disposiciones
and
aplicadas, por
regulatory
supuesto,
framework of
que
the
están permitidas
environmental
eliminar
conditions.
tanto
The
desde el
idea is
nivel
to be
nacional
able to
como
eliminate
territorial.
from the national
Por
level,
otro lado,
also
como
the
mencionaba
territory, and to
una de las
involve, as
personas
my other
invitadas, la
colleagues
doctora
mentioned,
de Honduras, no
Dr.
solamente es un trabajo de
Odalis
una
and
oficina o
Dr.
de un
Niles. This
grupo,
is not a
sino que
work of
involucrar a
one
las
entity. We
diferentes
need to involve
oficinas,
other
departamentos y grupos
offices,
involucrados con el tema,
ministries,
lo que es
and
directamente relacionado con la
officials,
prevención y la promoción
everything
de
that
las
has to do
enfermedades,
with the
pero también toda la
prevention
parte
and promotion
instrumental,
of
promoción
environmental
social,
of diseases. When we
asesoramiento
include, for
en
example,
medicamentos y
assurance,
demás.
the drugs,
Por
the
supuesto,
office,
el apoyo
etc., and of
técnico
course to
de
have the
esas
technical support
instituciones
of all
que
these
brindan
institutions that they
apoyo técnico y
provide
científico para los
technical and
Ministerios de Salud.
scientific
En
support
nuestro
for
caso,
the
pues
Ministry of Health.
contamos
In
con
our case,
diferentes
for example, we
instituciones,
have
como lo
different
son el Instituto
institutions
Nacional de Salud,
like the
el
National
Instituto
Institute of
Nacional de
Health,
Bacteriología,
uh,
el Instituto Nacional
Cancer,
de Vigilancia de Medicamentos y Alimentos, el
and
Centro
also
Tecnológico Federico Lleras Acosta.
the
Entonces, con
surveillance of
los
medication, etc. The fact is to see how
sería
can we strengthen the group little
multidisciplinario
by
poder
little
estar
from different
apoyando y
areas that
aportar a
can
la construcción
contribute to the solution and the
de las soluciones,
creation
¿no?
of all these roadmaps.
Importantísimo tener esos
Something
ejercicios
that
de
is
identificar
very
las barreras y
important. You need
brechas en el
to
manejo de la
identify the
OMS.
barriers and the
Esto lo que nos
gaps.
permite identificar
Why? Because this
esos
allows us to identify
situaciones que nos
those
permiten que los
specific
países
situations that do not
logren
allow countries
la
to be
eliminación, bien
to
sea de
manage the
transmisión
full
o la eliminación
elimination,
de la
that is
enfermedad como
either
problema de salud
transmission
pública.
or the
Hay que
elimination as a
identificar
health
cuál
problem.
es
You need to
la
identify
principal causa que
the
no nos ha dejado
main
avanzar y podemos
causes,
proponer
and
como
you
tal
can
cambios que
propose,
vamos a
for
trabajar en
example,
los
what are
siguientes
the
años.
things that you can do in the following
Por
years.
supuesto, entonces invitar a los países que
And of
están
course, to
comenzando
invite all the
en
countries
ese
that they
proceso
have
que se
started the
apoyen mucho
process
de la
to
oficina,
get the
tanto local
support
como regional de PAHO, pues
from the
que ya
local
tienen
and
establecida
regional
esa
PAHO
metodología,
office
la han
because
ido
they already
trabajando,
have the expertise. They've been
perfeccionando
working
en
with it
PAHO,
for a
ya han
long
tenido
time
apoyo en
and
puntos de
they've worked with
transmisión
different
y demás.
countries already. So
El
this is
segundo consejo
also important. And
es
the
construir
second
sobre lo existente,
advice is to be able
reconociendo
to
fortalezas, necesidades y desafíos,
acknowledging
pero no empezar de
strengthen
cero,
the
sino que es
strengths,
nuevamente ese
your
llamado,
weaknesses and the opportunities. The idea is not to start duplicating efforts. The idea is to be able to strengthen the work between the different organizations, because when you start proposing one program and then the other and then the other in the territories that they are going to start implementing, they're going to go like, okay, this is too much. You first told us to do this one way and then tomorrow you tell us to do it the other way. The idea is to be coherent between what we have seen that it has worked, and then from there to start building the work. Colombia, as well as Guyana and Honduras, they have experience in eliminating other diseases, like, for example, measles, rubella, polio, even in diseases that at that moment, because of the compliance of the goal, we can say that they are fully eliminating. Urban uh, programs with yellow fever, like, for example, other diseases transmitted by dogs. And there are some other diseases that they are not even seen in Colombia, but we need to start creating the structure, the evidence, so that you can obtain all these validations and to verify the elimination of those diseases. Okay, the third example would be to strengthen governance and the sectors from the beginning. In the case of Colombia, for example, in the construction of this specific plans, we've gone through three validation processes that are different. The first one was with the offices and the technical groups from the entities. And once that we were able to adjust the documents, we went to a second phase with the territorial offices, both from the different departments and the municipalities, that this is how politically the country is divided by, and also to learn firsthand whether if what we are proposing to accelerate and to achieve the elimination goals can be something that we can truly implement, because they have different realities in the different territories. We have geographical situations, demographic, cultural, social, etc. So we need to make sure that we have, in a certain way, the validation of what we are proposing. It is truly something that we can execute. And the third validation was to calling all the stakeholders from the academy and also from the side of science and technology. We had a very important workshop here in the Ministry of Health, where we had a participation of more than 45 institutions, delegates from different universities, public, private sector, the industry, all the entities. We even invited representatives from different associations of like, for example, Telehansen, which is the association of the Lepro Hansen Association in Colombia. And that's how we started to work with the documents. We have a document that is a preliminary document that is strong. And with all the contribution that we receive from the academy, it also helps us, because somehow they feel involved in whatever we are doing, and also the implementation of the national elimination program. We are aware that we need to strengthen the human talent in health, that is from the beginning of the formation, so that whenever they go to the territories, they are aware that we have all these situations in the country, that we have some roadmaps that they are there for them to be able to achieve elimination of diseases, and everything that has to do with gathering data, information, the research that we can use in order to be able to use it once that we want to achieve the elimination goals. And finally, of course, everything related to the country. So lastly, let me say that we are in a public consultation phase and the resolution program, so that they adopt this roadmap. So that's when we have the fourth council. At the same time, we will be building the elimination document. We will be drafting the elimination document, and to be able to rescue all these key elements that they need to be included in the binding documents, so that we can guarantee how we are going to use the plans in the territory and how they're going to be scaled, so that we can have a clear mechanism of the accountability of all the people involved, all the organizations involved. That is, from the
como la autoridad
ministries as
territoriales,
well as the
los
territorial
prestadores de los
entities,
servicios de
those
salud
that
y los
provide
promotores.
health services
Entonces,
and
esto
also
hace bien
promoters.
importante porque
This is
cada uno tiene
very important
claro
because
sus
each one,
responsabilidades
if everyone
frente
has
a los
clear all
frentes
their
de
responsibilities
atención de las
before the
comunidades,
communities,
pues vamos
before
a ir
uh,
articuladamente trabajando de forma
the
más
communities, the
organizada.
territories, we
Pues
can work in a
otros
more
aspectos
organized
importantes que
manner.
incorporamos
Other
en el
factors that
documento
we
para
include in this
consultarlo a ustedes
document,
es todo lo que tiene que ver con el cuidado integral de la salud,
everything that
desde
has to
lo
do with
individual,
health
y lo
prevention from
colectivo,
the individual,
indisociable.
from the
Está haciendo
collective
un avance
side.
en la
We are
gestión
moving
de
forward
salud
with
pública que
the
no podemos
health, public
reconocer.
health that we
Entonces,
cannot
pues
just
involucre esto, todo
leave
lo que
behind.
está
So we are
relacionado con la
considering everything that has to do
microterritorialización,
with
la
micro
microcoordinación,
territories,
porque
micro
si bien
planning,
el
because
nivel
even
nacional
though that
decimos
from the
siete
national
cabos,
level we are saying
tiene
to
que
each
trabajar
municipality, okay,
sobre
you need to
X,
work
Y,
on
Z
X
enfermedad
or
para
Y
su
or Z
eliminación,
disease for
pero
their
usted siempre está viendo
elimination,
estas
but
unidades
we need to
territoriales
scale up all
y
these
un poco a lo
initiatives
local,
and to go
a lo
from the
veredal,
big
donde
picture
realmente se está presentando el problema.
to the local
Incorporamos
part
también
where
todo lo
we
que
are
tiene que ver con el
experiencing problems.
financiamiento de las
Everything
unidades
that has to do
sanitarias, la
with
actualización
finance,
de los sistemas de
the
información.
updating of all the information systems.
Importantísimo el
It
comité
is also
sectorial y las
very
comités
important to have a
asesorio, por
committee
supuesto,
that will
los
help them,
investigadores y
the advisors, the
academias van a ser
researchers,
parte de estas,
the
así como las
academia that
redes
are the very important part of
de
these groups,
investigación
as
y
well as all
emprendimientos,
the
todo lo que está
information,
relacionado
the
con el
research,
seguimiento, monitoreo, iniciativa
everything that has to do
por
with
supuesto,
monitoring,
fortalecer la aplicación multisectorial,
accountability, to
conceptores que son
strengthen all
fundamentales
the
para nosotros como
sectorial
educación, ciencia,
work between
tecnología,
authorities,
innovación,
science, technology, innovation, environment,
arquitectura, minas y
agriculture,
energías, biotecnologías para el
mining,
desarrollo social y
synergies, and
desarrollo
all
sostenible.
the institutions
Finalmente,
that can be part of this. And
el
finally,
consejo es instarlos a que tengan
the
una
advice is to
planificación de
be able
actividades en
to
bases para recursos
urge
humanos.
them to have
Como
a
lo
good
mencionaba,
planning.
esto no es algo
As I was saying,
exitoso
this is not
que en un
something that you can
conocimiento
sit down on a
corto,
weekend and you
sino
will
es un
build a document.
proceso
This is a
que
process
involucra a
that will
muchas
take
personas,
time and
que
involves a
involucra
lot of people.
mucha
It
dedicación
involves a
para ir
lot of
puliéndolo de la
dedication
mejor
so
manera.
that you can
Y
be
por eso
able
se
to
encarga
draft
que
a
se cuente con un
good
equipo
document. And
técnico que
that's
esté
why you need a
comprometido en la
technical team that is
construcción,
fully
que
committed
esté
in the
enfocado y que sea
construction of this
colaborador.
document and that
Por
they work
fortuna,
all
en
together as a
Colombia
team.
nosotros tenemos
Fortunately, in
personas que
Colombia,
son
we have people who are
referentes incluso a nivel regional y mundial para
important
muchas
reference
enfermedades. Entonces,
for
es
different
bueno aprovechar
diseases.
ese
So the fact that we
conocimiento, las
use their
competencias y la
expertise,
experiencia
their
que también
knowledge,
trabajen estas
their
personas
skills
que le
of all
aportan al
this
equipo de trabajo de tal
group
manera
that
que
will
al final
provide
los
us
países
some
piensen en la construcción
in
de sus
feedback
unidades,
and
pero sobre todo
insight
van a
so that
tener
when we are
un documento
planning
que sea integral,
our
constructivo,
documents,
que
we
haya
have
sido
an
construido desde la
integral document that you
participación
know that this
y
has
que
been
esté
built
basado
from
en
the
la evidencia,
participation and
tanto
based on
técnica
the
como
evidence,
científica, que tengan metas claras,
technically and
realistas y
scientific, and that they
alcanzables,
have
con
realistic
presupuesto ahorrado
goals and a timeline.
y tener también claro el
And
propósito
the
final.
fact
No
that
me
they
puedo
have a
únicamente
very
trabajar
clear
por eliminar
purpose. We're not just
enfermedades,
going to work
sino también
for
involucrar
eliminating
y
diseases,
formar
but also
determinantes
to be able
sociales
to
y avanzar en
transform
la equidad,
certain
la
social
salud de nuestro
determinants
entorno.
and move
Entonces,
forward to
es
equity.
como ir
So it is like
generando esa conciencia
generating
desde
this
el nivel
awareness
central
from the
y
central
comenzarla a
level
difundir
and to
también
start
en los niveles
disseminating all
locales para
this
que
in all
también
the local
todos
and
sientan el
territories, that
compromiso y la
everyone
motivación de que
feels
es
the
algo que puede
commitment
ser
and the
alcanzable,
conviction that this is something
que
that
es
is
cuestión
reachable,
de
something that is
acelerar,
feasible, that we want to,
fortalecer
we
muchas
may
de
have
esas
to
posibilidades
accelerate
que
some of the
nacen
actions that we already have, but also at the same time that we have a little bit
y
of a
creo que eso
push.
sería lo importante.
And I think
Entonces,
that this is
crear
going to
como esa,
be important to be
esa
able to create this
sensibilización para la
awareness
construcción de los
and
documentos.
to
Al
work
final,
from
saber que tienen un
when we are
puesto,
creating the documents, that nobody feels that this is
porque
a
pues realmente
something that
esa
we are
también es una de
imposing,
las
because
barreras por las que nos
that's
están
one of the
muchas
other
veces
barriers
limitando.
that sometimes prevents us from
Excelente,
getting
Andrea.
to
Bueno,
other
creo que nos has dado un paseo
goals. I
por la
think that you
aplicación de
have given
todas las
us a
fases del
whole
proceso y
overview
hasta
of the
llegar
process, the
a la
steps up
gobernanza y la
to
apropiación.
the
Creo que
governance
el
of
mensaje clave
and
que nos
creating this
transmite es
roadmap. I
aplicar
think that it
inclusive.
is very
Es un
clear. The
proceso
idea is
tan
that this is an
inclusivo que
inclusive
está
process, so
vinculando a las personas
inclusive that you
afectadas por
even
la
mentioned
enfermedad
those
de
that are
Hansen, que han
affected
sido
by the
involucradas en
Hansen
la
disease, that they
construcción
have
y en
been
la revisión
involved
de
in the
este plan
revision
nacional. Así que
and creating this national plan.
son cinco
So
lecciones
I think that these
aprendidas en
are 5
consecutivos
lessons
que yo
learned
estoy segura que nuestros participantes del
and
webinario están
tools that you
apreciando
have
mucho
given
de
us,
lo que
and
se
I'm sure
habla
that everybody
de
who's
cómo ha
here,
sido
they have
intenso y interactivo el
they're very
proceso
grateful of hearing what you're saying. Now it's going to take me to Dr. Odalis Garcia. We moved with you again. I know that you have a very participative process in drafting your roadmap. Can you please tell me how is Honduras engaging national and local actors to ensure the ownership and viability of the roadmap once launched? Can you explain us a little bit, please?
Muchas gracias, Marta.
Thank you, Marta. Well, as we have heard from our colleagues, my colleagues, Honduras has been actively involved, and also we have involved all the local and national stakeholders on our strategic plans. And we've done this with a participation, inclusion, and transparency focus. This is key not only to ensure the ownership and viability of the plans, but also once that we launch them to guarantee that they will be successfully implemented. We've applied a micro-planning focus and governance, collaborative governance from the beginning of our work to be able to prepare this elimination roadmap. Now, let me say that it's important to say that aside from or differently from other plans that we have developed from the central level, this specific roadmap that has been developed, we were able to do it by means of mechanisms that will ensure their success. And also when I talked about the micro-planning perspective, it's so important to ensure the technical and operative viability.
Honduras has invested the planning pyramid, so to speak. Let me give you an example of how we have done this in practice, which is malaria. Local microplans have been drafted, so instead of having a general national plan, we have very specific operational plans at a municipal level where the local healthcare teams and the local communities together determine their specific needs. Budgets have also been generated at a local level, and of course, they communicate with the national budget, and this can guarantee that the funding is allocated to activities that local stakeholders have identified as viable and necessary. Working groups have also been established to co-create and prioritize in order to guarantee the political and institutional ownership of the process. Some important milestones have been identified as well in the priority setting workshops. There have already been several workshops organized. As my colleague from Colombia said, this is not work that can only be done in a single day or having a single meeting, a single workshop, but rather it's very many hard days of work involving not only the Ministry of Health, but members from the academia, civil society, other partnerships, other partners, not only PAHO, and everyone together help to determine which out of the 30 diseases and related conditions should be prioritized in order to achieve their elimination in Honduras first. All of this was done considering the life cycle, that's the approach, with stakeholders from different departments of the Ministry of Health. So not only at a program level, but also more specific sectors such as maternal health or child health care, first primary health care. All of that has been important, as well as information data collection, which is very important to make decisions. So the planning and assessment unit has also been involved in every step of the process to guarantee micro planning. So the surveillance unit of the health ministry, laboratory experts, many institutions have been involved to really have an integrated approach. We have also acknowledged that elimination is simply impossible if the community is not involved. So community engagement, finding local volunteers that are trained and that are involved in the creation of a network to do early diagnosis and continuous surveillance, that's essential. And having them involved since the very beginning, since the design phase of interventions, that's what makes them feasible and that's what makes them sustainable. Local governments have also been involved, so including the emergency committees at a municipal level. So in order to figure out the logistics or other auxiliary sectors that support the healthcare strategy. Because only if all of those are involved, then the elimination of diseases and related conditions can be achieved. The Ministry of Finance has also been involved since the very beginning. The Vice Minister for Finance was participating in the meeting since very early on. This is also key in order to guarantee that the activities of the roadmap are considered in the national budgets. Otherwise, they won't be sustainable. The participation of local authorities has been critical, especially for some specific health regions that were identified as key and that participated very actively by sharing data, experiences, and the specific needs identified at the local community level. So regional consultations are being organized to analyze the strategies that are proposed and see if they can be viable and adapt to the variety of contexts in the country. Honduras is also used, I mentioned this before in my previous intervention, the tool given by PAHO to make the best potential investments for elimination of disease. So understanding the most cost-effective interventions and guaranteeing that whatever we choose to do is cost-effective. I think the support that we have received by PAHO has been very useful. I have already mentioned this before. They have provided technical advice, they have shared methodologies, they have facilitated a discussion between sectors and stakeholders, and they have allowed us to be better aligned with regional standards. So having a synergy with the United Nations, with regional cooperation systems, makes sure that all efforts are well articulated and multilateral agencies are all involved, because this is what can guarantee sustainability, financial and technical sustainability throughout the process. So it really has to be a participatory approach. It's what we have tried to do throughout the process. And it has helped us not only to design the roadmap that we have today to make sure that it's technically sound, but it can also guarantee that local stakeholders will take ownership of this roadmap so that it can be adopted and operationalized with the full commitment of the communities. Because again, this is what will make it sustainable, and this is what will make it possible for us to achieve the goals with the 17 diseases that the country has selected after a very deep analysis. So in order to guarantee the elimination and then maintaining that elimination by 2030, it's the only way to make it happen. Thank you, Odalis. You have shared many details about the importance of an inclusive process, a participatory process. I think this has been mentioned again and again. It's not only about having strong programs, but about having the participation of the whole Ministry of Health and related institutions and other sectors and partners, agencies at a regional level, at a local level. Local authorities have been mentioned as well, micro planning, micro territories, because that's essential. Diseases have to be understood in context. And I think all of these elements that you mentioned really highlight the importance of inclusion in the process, because the more inclusion there is, then the more ownership there will be, and that's what will accelerate the elimination of diseases. It's a multidisciplinary approach involving many different components, and this can help us transition perfectly to Dr. Niles from Guyana. I will switch to English now.
After having all these lessons learned from Colombia and from Honduras about how they have included many people and organizations, agencies, local leaders, majors. What are the main lessons learned from Guyana that could guide other countries that are ready to put together the roadmaps for the multi-disease elimination?
Thank you, Dr. Saboya, for that question. And as you've said, we share experiences and we share a lot of the similar achievements and challenges like the other panelists said. My first lesson, and I wanted to reiterate it once more, is that elimination roadmaps and activities move faster when there's explicit political ownership and clearly defined set of priorities. In Guyana specifically, our ministers' engagement, especially too when we have our technical meetings, our ministers' involvement, even when we had the PAHO joint mission for elimination, he is there and we have a clear mandate and even a sense of urgency. I would say for countries, therefore, they should begin ensuring that the elimination is visible for the country wide. Elimination should be visible. It should be articulated political priority and not just like a technical aspiration within individual programs, so that the entire country, their mindset as well is geared towards getting rid of these diseases, these burdensome challenges that could be prevented and your future generations won't have to suffer. So I wanted to reiterate that once you have the explicit, visible, well-articulated political priority of elimination, I think that's one of the best steps that you can do. And I would emphasize that will help a lot of the activities go a lot smoother. I would say the second point I wanted to emphasize, and you mentioned it in my previous engagement, governance. The technical working group has been essentially even bringing us together, understanding what our colleagues have done, their experiences, reviewing your evidence from a different point of view, maybe even seeing areas you can intervene quicker. It ensures a lot of national guidance and coherence across these communicable diseases and primary health care, which I would say honestly is something that we have now start pushing a lot. We want our interventions to be like the other colleagues has indicated at the problem, at the locality, at the community level. So I would say, therefore, for other countries, one recommendation would be to establish such a group early. Before, I would even say before your roadmap is drafted and launched, you have multiple stakeholders, even within your very organizations, and even outside, so that you have a structured mechanism to guide the development of the roadmap itself and even to oversee its implementation. That would be my second recommendation. Have this done early. The third will be implementation experience matters. Your experience matters. As the other colleagues have indicated, they've eliminated a few diseases before. We too have as well. And even our experience with the lymphatic filariasis campaign, we've gained experience. We've gained experience on how to engage the community. What are our challenges? What is feasible and what is not feasible? So I would say for the countries, even I just want to even emphasize when I mentioned the Region 9 activity, which was specific to malaria elimination in that area, that helped us understand too that not every model fits every place. So I would say when you're creating your roadmap, understanding from the locality and the village level will really help you not be frustrated. You might even have quicker gains and you'll have the community buy-in, and your roadmap will be something that is used and not another document tucked aside in the drawers. The fourth would be to invest in good information and information tools. I would say this can significantly accelerate your elimination planning. For us, and we have a lot of information. We've done micro planning for filaria, we've done micro stratification for malaria, but probably one of the things that helped me see elimination across the disease would be the information that we gained through the serosurveillance. I've been able to better appreciate this multi-pathogen antibody data that we have. We even have experience where this data we've been able to collect allow us to look at other diseases, for example, trachoma, where we can do some targeted interventions. We don't have to go across all the regions, and feel frustrated, or we don't have resources because of lack of funding. We can go targeted. So when we're speaking to the finance guys or even for funding, we can say, let's go there. We have evidence to back us up. So good information. If you already have those information, you can utilize it that way. Of course, having as well a good digital health system, like my colleagues mentioned from the panel, is good as well, because the quicker you can translate that information and analyze it, the quicker you can have implementation and even a good lab network. Some places for us, we've noticed some regions, they already have a good system. There's no need to reinvent the wheel. I would say pivot, and based on context, you can apply it. And of course, interoperability, because many places use different systems, and that's not a problem. Once they can talk to each other, once the information is translatable, you can move forward. So I would say for the countries, invest early in good information. So take advantage. We took advantage of our surveys through the guidance of our PAHO colleagues and CDC. We're able to gain information many years ago that we're still using today for elimination. Invest early in information infrastructure too. It will benefit you when you need to not only analyze and move forward, but even for your dossier for validation, you have the evidence to show what you've done, to show impact. The fifth, but not the least, community engagement and multi-sectoral collaboration. Guyana experience has reinforced that elimination is not purely health sector exercise. Perhaps we've learned the hard way when we've done it like that. So I can tell you, even based on our filaria campaign, which really has propelled us so far down the line, and even the Malaria Region 9 initiative, and even the pilots, the Tashao, the village head, the teachers, the mine owners, the community health workers, those people really are the ones who help these roadmaps and elimination actions really get done. They're the ones who validate if it makes sense. So I would say similarly, the roadmap process has highlighted that the importance of involving other sectors. And I'll just list a few for you guys who are like me, who make notes. Our Amerindian affairs in our context, whatever that is for you, our education, our ministry, our housing sector, our water, and even the environmental agencies to address the social determinants that drive these vulnerabilities. So for other countries, I would say the key takeaway is that community engagement and the multi-sectoral collaboration should be designed into the roadmap from the beginning and preferably not added at the end. So I would say taken together, these lessons suggest, and I would even say prove, that multi-sectoral elimination roadmaps work best when they are grounded in political leadership, robust being the key word here, technical governance, real-time piloting or your experiences that you already have, micro-planning, micro-stratification, information systems, and genuine partnership with the communities and other sectors. Thank you.
That's great, Dr. Niles. You have highlighted very well that engagement at all levels, the highest, the technical, other sectors, community engagement. So this is critical. That is easy to say, but it's a long process that demands patience, but continuous work, because once you have the mandate, and you mentioned that, I have the mandate, it's my Minister of Health saying, we are going to do this. It's not an option. We are going to accelerate. As soon as you have that, you can take advantage and move forward. And I would like to highlight also that you mentioned use your experience, use your capacity. You don't have to invent the wheel. And that is exactly the process that we have conducted in the several countries working on the elimination of diseases roadmaps, is that you already have a capacity. You are doing so many things. How we can use that experience into accelerating the elimination of several diseases. Even though we have been working in silos, those silos have a lot of experience.
Yes.
Those silos have already implemented solutions that may help other programs, other diseases to accelerate the pace. So thank you very much, Dr. Niall, for highlighting that. And I would like to invite now all of you, Dr. Niles, Dr. Garcia, and Dr. Castillo. And I'm going to switch into Spanish, Dr. Niles, if you want to use the interpretation channel. So voy a invitar ahora a mis tres excelentes panelistas. Bueno,
Now I would like to invite all three wonderful panelists. They have given us such a robust understanding of the work that's being done. Adriana, I don't know if you're still there. I hope you can join us as well so that we can have our three panelists here. And there have been many comments and questions. There has been a lot of information exchanged by our participants, and I will try to maybe group some of the questions, maybe share some comments. And I see a very special question here about how to integrate the work being done in human health and animal health. So speaking of One Health, I don't know if one of you would like to talk about what is being done to introduce One Health in the roadmaps. Maybe I'll ask you to be brief so that we can also answer other questions. Who would like to go first?
Adriana.
Bueno, sí.
Y luego Odalis.
Perfecto.
Adriana and
Bueno,
then Odalis.
esta es una estrategia
Okay, so
programática que
this is
consideramos tanto en el documento
a strategy that we have considered
y para documentos
in many
específicos
programs
como
in the
por ejemplo
cross-cutting
esta
national
humana
plan.
transmitida por perros
And specifically, for instance, for
aquí la intención
diseases that
desde
are
el
transmitted by
Ministerio de Salud ha
dogs.
sido
And in the
con
Ministry of Health,
la Subdirección de Salud
we've
Ambiental
worked
y ya con los
very
otros
closely
sectores.
with the
Desde la
environmental
Comisión Intersectorial se ha planteado trabajar esto justamente
agencies.
con otros sectores,
And
incluso
the idea is
con
to start approaching other
estos
sectors as
movimientos
well
que son importantes para la protección de animales,
to understand
considerando, por ejemplo,
everything that's
el
necessary for
Ministerio de
animal
Agricultura,
protection as well. So, for instance, the
Ambiente y
Ministry of
Minería y Ambiente,
Agriculture, Environment,
evidentemente todo
Mining,
el
and
impacto que
Energy,
hacemos nosotros
because
como
all of the
esperando
impact
que
that we
el comportamiento
have
tanto
in
de
our
los animales
surroundings
como
as
de
human
las
beings, of
personas es
course, has an
fundamental.
impact on
Entonces,
animals
va a
and
ser un trabajo
therefore in
más
vector-borne diseases.
predictivo
So,
de modelamiento
it's more of a
para
predictive
alistarnos
work, I would
y
say. There's a lot of modeling that needs to be done to be ready and also to incorporate anything that the other ministries can give us as information of what is necessary, especially with animals that are pets, such as dogs. Odalis, would you like to answer?
Sí, brevemente comentarle que en Honduras
Yes,
se
let me
está
tell you
realizando
that
un
in
trabajo
Honduras we are carrying
coordinado en el
out
marco
a
de
coordinated
una
work
salud. Hemos tenido una
in regards of
experiencia muy
health. We've
positiva
had a
con el
positive experience
proyecto de fondos
with
pandémicos que
the pandemic
recientemente a finales
project
del año
that
pasado
recently
ganamos y que estamos
we
implementando
won and
durante
we are
este
currently
año y
implementing
que
during this
precisamente el
year,
enfoque que tiene es
and
el
that
enfoque de una salud. Nosotros
precisely we're talking
coordinamos
about
estrechamente con la
health. We are
Secretaría de Salud y
coordinating
Ambiente
with the
y con la
environmental
Secretaría
ministry
de
and also
Animal
with
con
the
SENASA y
animal
con
ministry called
ICF
SENASA,
para todo el
ICF,
trabajo
for
coordinador.
all
De
the
hecho,
coordinated
estamos
work. As a
desarrollando
matter
un
of fact, we are
trabajo muy
developing
interesante
a
de
very
análisis de
interesting
los
work.
sistemas de
We are analyzing the information systems of each one of these ministries and how we are going to be able to manage to integrate all these information systems and to find out what else do we need from, in terms of information, from the human health perspective, animal health, environment, and vice versa, in order to be able to work and to respond in a more efficient manner. And of course, how we can eliminate diseases. And Adriana mentioned this about human rabies, that we still have a lot of progress, and we are in the process of documenting human rabies transmitted by dogs, and also the intervention of the sector, that is the Ministry of Health, Animal Health. It is very important so that we can achieve all the goals and to have a good diagnosis and to document everything that has to do with what we are experiencing in the country. So for the implementation of the elimination roadmap, the joint work is paramount. Thank you, Odalis. Dr. Niles?
Thank you, Dr. Saboy, and I'll be very brief because the colleagues already mentioned a few elements on this One Health. For me, One Health allowed us in Guyana to start thinking about health on just not the health sector, but in the entire system, because we've been able to interact with our agriculture, so animal health, human health, and the environment and climate, which I would say are paradigms that, while we know at the back of our minds, it was brought really to the fore in how we engage in a more systematic way for disease elimination. We're fortunate to be beneficiaries of the pandemic fund with the team of One Health. And really what I see it doing, not just strengthening our health systems, but the entire system. Really and truly, the disease doesn't just operate under the paradigm of health, but it touches the animal, it touches the climate. And if we're not dealing with all of those elements, some of the gains we have gotten might be lost if we don't address it. So I would say for One Health, if you underpin it in your strategy, recognizing where these elements can be probably prominent or not, but still have it in mind. What we've seen in Guyana is that the disease process is evolving. So you need to be dynamic and innovative. And I think One Health thinking will allow you to maintain those gains and keep them, because this is an evolving, I would say, evolving system. So yeah, the One Health paradigm is one that should definitely be included. And I think you already do it, is just bringing it out more to the fore.
Yeah, excellent, Dr. Niles. Thank you. Tenemos muchos comentarios. Hay varios colegas que han compartido que ellos han
We have
eliminado
several comments. For example, some colleagues that they have shared with us that they've been able to eliminate multiple diseases. And I know that this is something that the countries have been able to achieve. There's a lot of information, but the point here is, how do we accelerate the process? An interesting question is that how do we do that once that we are able to eliminate a disease and that you're in the final phase, because I know that you are close to eliminate some diseases. How do we keep helping the communities and not just let them there forgotten? I mean, okay, we eliminated the disease and then we just forget about those communities. How do you ensure that all these communities that we're working with, and even though that once that we achieve a full elimination of a disease, what happens after? How can you work with them? I mean, you mentioned, of course, all three, that the three countries are currently working in strengthening the primary care. And I'm sure that not only you eliminated diseases, I don't know who was it, Adriana or Dr. Niles. This is not just a matter of eliminating diseases, but what else? So Dr. Niles, you have the floor first.
Thank you so much for your question. I think it's very relevant. I too was under the perception that when a disease is eliminated, the work is done and you can relax. And I really would illustrate it as a needle in a haystack. You have one pearl and you have to hold it on because it could fall in the hay and you have to dig and find it. And I say all that to say that One thing that we need to do is keep reminding ourselves of what we've done. I'm actually fortunately in Suriname, and I see one of the things that they have done very beautifully is really empower the people that helped elimination and keep them on to encourage other disease to be eliminated. So they're still working. What has happened, their services has expanded. So I want to thank Suriname for helping me with a little bit with my answer. But it's a similar thing we see too. When the diseases don't operate in silo, unlike us, sometimes we like to operate in silos. Most likely we see diseases, for example, malaria, HIV, and TB, they're tied together for a reason, probably the same risk group, etc. So instead of, if you've eliminated malaria, you still have another set of diseases. You keep reinforcing, we've done this great job, we need to maintain gains while you expand services. I think that's one of the ways that you can maintain it. Also, maybe recognition time. Some countries I've heard they put up billboards and they say this is the number of cases, this is how we did it, and you reinforce it in the training because we've eliminated diseases, a lot of vaccine preventable diseases, but now we have diseases emerging. Have we forgotten what we've done? We've not maintained. So I think we need to put that paradigm now, maintaining elimination as possibly a point in our disease elimination. What we need to do, we have to put more, we have to keep because that interest goes down. But the disease is smart. They're waiting for us to close our eyes to pop up again if we're not too careful. So that's just my few words I would like to offer to the panel.
Thank you, Dr. Niles. No sé si Adriana o Dalis quieren hacer
Adriana or
comentario.
Odalis, Dr.
Sí,
Odalis?
muy brevemente, yo
Yes,
creo
briefly, let me
totalmente de
say
acuerdo
that
con la
I fully
doctora
agree
Niles.
with Dr.
Yo creo que el
Niles.
reforzamiento
The
de la
fact that
atención
we are
primaria en
always
salud,
reinforcing
la
the primary
vigilancia
care,
epidemiológica
health,
es fundamental
epidemiological
para
surveillance
poder
is
lograr
very
y
important so as to be
mantener
able
los
to
logros
manage and to
que
keep
ya tenemos. El
the
tema
objectives reached.
tenemos
I mean,
muy cerca y muy reciente
we
el tema de
have
sarampión.
the
Entonces,
experience,
yo creo
very
que
close
la
experience
amenaza
of measles.
que
So I
tenemos con
think
el
that
tema
the
de
threat
sarampión, de poder
that we have with measles, for
perder
example,
esos
the fact
logros
that
que
we
hemos
may be
tenido nos
able
tienen
to
que
lose
traer a
the
la
achievements
reflexión
from the
de que
from the
tenemos que
past, we need to
mantener el
think
tema
upon
en
this. We need to
mente,
keep
de
the
que tenemos
topics
que, sobre todo con los
valid,
nuevos
live,
profesionales,
that we need
porque como
to
son
work with the new
enfermedades que ya
professionals, because
existían,
since
no
these are
seguían,
diseases
pues
that
entonces los
sometimes we
nuevos
don't even think
profesionales no
about,
empiezan
then
en
the
ellas,
new
no las miran,
professionals,
porque
they
están
don't even think
eliminadas.
about them. They
Entonces
go
no
like, oh,
piensan
it's
en ellas.
eliminated,
Entonces
and
yo
they
creo
don't
que el
even
tema
think
de
again
mantener
on
vigente,
those.
de
So the fact
mantener
that
el
we
tema
always keep them
de
valid,
reforzar
the
que
fact that
sí
we
se
have
han
to
eliminado,
reinforce that,
pero
yes,
ahí
they
están,
might
que
be,
pueden regresar,
we've been
es
able to
súper
eliminate
importante
those, but
y
they
esto
can
tiene que
come back at
trabajarse
any
desde
point.
el
So we
primer
need
día.
to work always from the first level of care all the way up. And just very quick,
a lo que pues ya nuestra
adding
colega
a little bit
comentó
of what
ahí,
our colleagues have
ayudarnos
mentioned,
a transportarnos al momento del futuro.
we have to
2030,
move
2031,
towards the
tenemos
future, like
como que hacer
2030,
una flecha
2031. We
ahí
may say, oh, in Colombia, we don't
similar,
have
igual en
X
Guyana y en el
year,
futuro.
or maybe
Pero
the same in
justamente es
Guyana or in
eso,
Honduras. But
rescatar
that isn't the
todo el
main thing. How
fortalecimiento
can
que vamos a
we
poder tener durante estos 50 años,
rescue all the
toda esa
strengthening that we've
optimización,
managed to get
todos los
by means of our work during all these years, and also to take it to the future? How can we have a good infrastructure, resources, inputs,
y el
trained staff,
fortalecimiento de
and
las
to remember that
enfermedades
many
no
of the
logramos
diseases we do
eliminarlas
not manage
como
to
interrupción de la transmisión.
we do not
Vamos a eliminarlas
interrupt
como
transmission. We
problemas
may have, or we may be able to
van a quedar
work with them,
simplemente
but
pequeños
eventually we will have
números de enfermedades
small
en la
numbers
población,
of
pero
these
eso
diseases
solo
in the
se puede
population, but it belongs
combatir
to us, and it's our responsibility
durante las mismas
and the
comunidades.
public health sector and
Lograr
the
que
community
eso
to
que
manage
pensemos
to
a
protect
2030, 2031 para
these all the
no
way
tener
to
nuevamente
2030
esas
or
enfermedades como que tuvimos
beyond that, because to avoid these
Yo
diseases
creo
to
que
come
es
back as a
clarísimo
public health
para nuestros
risk.
participantes.
Yes,
Las
for our
estrategias no solamente
participants,
son
these
para eliminar,
roadmaps are
sino
not
para
only just to
proteger los
eliminate
logros.
diseases,
Y
but also to
proteger los logros
protect the
puede ser
achievements.
todavía
And
más
this could
difícil
be even
que
more
el mismo
challenging
logro de la eliminación.
that to
Y por eso
eliminate,
las
to
evaluaciones
manage
nuestras
the
se enfocan
elimination. This
en
is why the
ambas áreas,
roadmaps
que es
are focused
fundamental
on both
hacerlo.
areas, because
Y
it
una
is
muestra de
very
ello,
important to
la
consider
doctora
this.
García
And
lo
also,
dijo, sarampión. Si
Dr.
nosotros nos
Garcia
descuidamos,
mentioned this. For example,
ahí
measles.
tenemos una
The example of
advertencia
measles, if we
después
just
de esta
forget about
enfermedad.
it, they could,
Nos han preguntado
they can
muchísimo
come
sobre
back,
la
and now
resistencia
we know the
antimicrobiana y
situation.
como estamos
And
acercándonos al
when we're
final,
talking
solamente
about
le puedo
the
comentar que
resistance, the
efectivamente el tema de la resistencia antimicrobiana
yes,
es
this
parte de las líneas
microbiotic
transversales.
resistance is part of the
Pues mira que hay
transversal
cosas
lines. That is, that we
que
need
se
to
mencionan
say that, yes, they are mentioned, and due to the time that we have, we cannot touch upon that on differently, but we have this microbial resistance. It is included, and also other moments that are not listed as diseases. For example, when we talk about open defecation and the use of contaminants or pollutants in the houses, of course, touches upon water, housing, and healthy living. And there are many aspects that they are key for the elimination initiative. And we have another question there that it says, and I would like to get very short comments. How are we guaranteeing this, all this knowledge to the new generation? So I know that you are part of this generational, that you've been able to convey this to other generations. But how do we achieve this?
Pues ese es un trabajo difícil.
This is a very difficult job, but as you mentioned, Marta, the fact that we've been able to do it, and we will continue to work like this, the fact that we can share experiences, we can form other generations, because I'm on my way out, and it is very fundamental to be able to keep all the achievements so far, and maybe to obtain even new ones. So as you've mentioned, okay, what are we going to achieve for 2030, but who's going to keep that achievements valid beyond 2030? And I talk about the relevant topics, and I think that all of these is very determinant so that we can keep working and be successful in the future. Adriana, Dr. Adriana? Did you hear us, Adriana? It seems that
comments on this?
Yes,
she's having some issues. Okay.
I would like to just share my real experience. Before I joined this public health program for elimination, I was just a normal doctor, and a nurse who was a part of the elimination process came to give me my filaria pills. And she said, Dr. Niles, this is why you need to take it. And she told me about vaccine preventable diseases and the work that was done. And now we're doing this, and she inspired me. And a couple months, I'm now the head of the program, and I have to give a speech. So the reason I'm giving that example, there is a way. You need to be passionate about what you're doing and understand why you're doing it. And just like how I was one person who benefited from such a speech, she didn't even show me a PowerPoint. She just showed me in her. We communicated as persons who suffer from diseases and we don't want to get it. So I think you need to have champions. I would say our minister is a champion. If you continue to have champions, and even at the community level, one champion is enough to encourage multiple people. I think that's one of the ways we can get the other generation. I think I'm the other generation. But the other generations, my nieces and nephews, and even cousins and family and friends, one passionate person, keep getting people passionate for disease elimination, control, whatever it is that we're doing, and we'll be able to continue these gains and tell them about the cautionary tales as
Great.
well.
Thank you, Dr. Niles. Adriana, por favor.
Bien, bueno, sí, como lo menciona la doctora, de pronto nosotros también hacemos
Yes, as
parte
we have heard, sometimes we are part of this generational issue, but as Dr. Niles is explaining, basically, the fact that we can keep this interest ignited, and also the work that we do with a community. Something else I like to rescue from all of this is that we are proposing that before present ourselves as a country, we can do this self-assessment in order to be able to see, for example, how the territories are working, because that could help us to be able to find that from all the areas, Bichal, Amazonas, the Pacific Coast, the East Coast, as we may be able to move forward and to see whether if one territory has met the objectives, we can inspire others. And from there, from the local side, we can motivate others to say, hey, listen, this is very interesting, and they may be motivated. And not only those are there part of the health sector, but the community itself. Because right now, the digital world and the generations, they may have other interests, but We need to find ways of attracting them and to tell them that the health and social work is so important for everyone. We may be talking for hours about this, but I would like to thank you for your contribution, Dr. Castillo, Dr. Odalis, Dr. Niles. Thank you for being here with us, for sharing your knowledge, for sharing the challenges, the experiences, the messages for the others. I think that we've managed to meet the objective, just to share the experience with others and how you drafted a roadmap in the elimination of diseases. So thank you. We're going to keep in touch. We'll have other webinars, so I'm going to invite all the participants and I'm going to ask our panelists to stay. We're going to give you a list of webinars for next year, and we would like you to vote on the next topics. When we talk about being inclusive, participative, so please give us your input. You have a list of possible topics for the next series of webinars. So you please can choose those that you like us to have. We have integrated health services for the elimination of communicable diseases in vulnerable populations and territories. Intersectorial work to accelerate the elimination of communicable diseases and related conditions. Documentation processes to verify the elimination of communicable diseases. And the last one, methodological approaches and the use of integrated serosurveillance data for multiple communicable diseases. Dr. Niles, you talk about this. So, okay. We want your opinion. We believe that this is a great opportunity because we all are very interesting topics that we would like to address, but we wouldn't like to, miss the opportunity since we have so many attendees at this meeting. If you could be so kind to let us know about your interest. So without further ado, let me just say again, thank you to our 3 excellent panelists. 5 stars, really, thank you. Thank you for all the work that you are now leading, for the progress that you've been able to achieve to eliminate multiple diseases and to eliminate and for everything that you do. All the participants, thank you. Thank you for all the questions, your comments. The interaction was great. Thank you. My colleagues from the PAHO offices, as the headquarters, as well as the regional offices, and our interpreters. Without them, it would have been impossible to be able to have so many people participating from Pakistan, for example. They were participating on the chat and saying how this is helpful for them to be able to move forward with the elimination of diseases. Now, recordings of these webinars in 4 languages will be available in the following days in the same webpage where you found the agenda. Thank you so much. I wish that you have a great weekend, and thank you so much for sharing with us so many knowledges and your input. Thank you, and enjoy your